Welcome everybody. I'm joined today by Dr. Lana Jackson. Lana is a senior clinical psychologist, yoga therapist for mental health, and mindfulness teacher specialising in child and adolescent mental health and paediatric psychology. So thanks very much, Lana, for joining me.
It's lovely to be here. Thanks, John, for having me.
So just to say that we're going to do two parts to this interview. So the first one, we're going to talk about EMDR. The second one, we're going to look a little bit more at EMDR, but also ecotherapy. So just to start off, could you tell us a bit about what EMDR is, Lana, and explain how it works?
Yeah, so EMDR stands for Eye Movement Desensitization Reprocessing. So it's a evidence-based psychological therapy, which was developed originally for post-traumatic stress disorder, so PTSD, and it is in the NICE guidelines because there's such a good evidence base for its effectiveness for PTSD, and is offered on the NHS. And the World Health Organization also recommends it for children and young people as well. So when we experience a traumatic event, often our sort of physical systems are completely overwhelmed because we're not able to escape from that danger. And the kind of thinking part of our brain sort of shuts down, and the lower parts of the brain, the sort of brain stem and the limbic system sort of take over. And that kind of basically helps us to protect ourselves. It's like a threat detective system. And those kind of lower parts of the brain, they deal with sort of instinctive survival mechanisms. So we're very much kind of in that fight or flight, or we go into sort of freeze and immobilization. So when we then come out of that traumatic episode, often what people experience is that they have experiences of sort of quite physical reactions from that. Their nervous systems are kind of challenged, but they start to process what's happened through talking about it, and the higher brain gets involved. But for some people, those memories and those traumatic experiences get locked in the kind of lower brain, and they're not able to sort of process that in a way that kind of helps the body to come out of it. So when they experience things in the environment that might remind them or remind the lower brain, it might be completely unconscious, but the brain might detect maybe a smell or a color or something in the environment. The brain will sort of fire off, and it will experience this the trauma as if it's happening in that moment rather than something that's happened in the past. So what EMDR does is it uses what we call bilateral stimulation. So it's either, and I'll show you a version here, through sort of butterfly taps, we call them, or butterfly hugs, or kind of bilateral tapping, which you could do on yourself, or somebody could do that to you. So your therapist might tap on your knees or on your hands, or through eye movements. So the classic, due to it being called eye movement desensitization reprocessing, is the kind of movement of the eyes from side to side. And this, we believe, there's lots of different theories about like how that kind of supports people with trauma, but the kind of the ideas and the theories around dual awareness, I think, are quite helpful. So what we do is, while we're doing that bilateral stimulation, we're also very gently bringing people back into the memory of the trauma. And we're just asking them to notice it, be curious, sort of be with it. So it's quite a mindful process in a way, but at the same time, you're doing the tapping and the eye or the eye movements. So there's something about us being able to be with that memory, but also be very present and engaged with the tapping, so with the therapist. And we know that mindfulness and being very present and engaged in the present moment actually helps to bring on the higher brain. So there's something about this mechanism of maybe the motor areas of the brain getting involved, but also the higher areas of the brain getting involved, that mean that those memories can be reprocessed, so that that memory is something that's happened in the past. And people say they still remember that it happened, but there's not that physical charge, that kind of physical distress around it. And it feels like it's something that's happened in the past, not something that's happening now.
And is it very different when you do it with children then, or you've got a different sort of context for children?
Yeah, in some ways. I mean, we use exactly the same basic protocol. So there's certain stages and it's very structured. And we use the same structure for children. But there's certain adaptations that we might make based on their age or the developmental age of the person as well. So some examples of that might be that we might actually use the parent as a kind of co-therapist. So the parent, if they are a very protective, nurturing figure in that child's life, it's not always the case and not always appropriate, but we might have the parent involved. So the child would sit on the parent's lap and then the parent would do the tapping on the child while I'm telling the story or doing some of the other work. The other thing that might be different, and I just mentioned it then, is this storying. So for children, it might be that I kind of co-create with the parent a story about what has happened. So if the child is quite young, it's more helpful sometimes for the adults to kind of create a bit of a story about some of the things that happen to the child, including some of the emotions or the difficult thoughts that they might have had. So for example, in medical trauma, it might be around kind of, a lack of control and not feeling safe when in that situation. And then this story will resolve and will come to a kind of positive conclusion where the child also has a kind of sense of themselves kind of in a more positive light through that experience. And so we'd kind of do the tapping or drumming sometimes while the story is being read.
Right.
Yeah,
great. And obviously it's a question I've been asking lots of rehabilitation providers recently about COVID and how that's affected what people are doing, but how has it changed how you might deliver EMDR?
Yes, that's interesting actually, because since the COVID outbreak, like all of my work has gone online. So I do video calls just like this with families, and the EMDR community were amazing actually at being very supportive, and they provided lots of free training for EMDR therapists worldwide that really sort of helped people take it online and be able to deliver it through COVID. So I've been really surprised actually, because I was a bit concerned about like how you might establish rapport and safety like online when you're not in the room with people. But actually I found it's been really effective for most of my clients. I'd say you kind of need that client to have a safe environment. As long as they have a sort of safe place that they can call from, this work is sort of possible. And obviously that's not possible for everyone. But yeah, I suppose some young people have actually said that it's been quite beneficial doing it online because they don't have to come to the hospital, or they don't have to kind of travel and have the kind of extra time either side, that they feel quite safe at home. There's less travel, and they have found that they've been able to kind of develop that relationship online. So it's kind of, so far it's kind of been working quite well.
And presumably some people that it hasn't worked for, or not, or has it generally been okay with everybody? Yeah,
I mean, all of the people I've done it with online, it's worked for. Say there's probably a few that wouldn't want to engage online, or maybe don't have a safe enough home environment that wouldn't necessarily work for. Yeah. But for those that kind of do have that safety at home, it's been working well.
Great.
The other great thing actually, I was just thinking, is how I can use the children's resources at home. So I might invite a child to go and run and find like one of their favorite toys, and then we might actually use that within the therapy to kind of install safety and comfort while they're processing the trauma. So it's quite nice that can also be kind of done when you're doing it with people in their homes.
Brilliant. Well, that's great, Lana. Thanks. That's a good insight into that very short snapshot. So that's the end of part one. We're going to come back and see you again for part two. So thanks very much, Lana.
Okay, thank you.